Thank you for being here today. The weather's crazy. Appreciate everyone making the drive. We are celebrating the launch of our 8th location of Sage Infusion. Sage Infusion started back in December of 2019, and since that time, our team has grown, our patient volume has increased, our relationships have been developed and partnerships have been developed, but our purpose has remained the same, and that is to provide exceptional and innovative care for our patients. We have an amazing team of nurse practitioners and nurses who provide one-on-one compassionate care. We have a dedicated intake team who strives to provide best-in-class intake experience for our patients and also for our referring office. And we also have a commitment to provide financial transparency for our patients. And we provide upfront pricing as well as a cost estimate prior to each appointment, outlining any out-of-pocket costs that the patient may be responsible for. Our goal at Sage is to provide the most exceptional care at the most affordable cost, and we will continue to try to do that. This site here in Lady Lake, near Spanish Springs, is our second site in the Villages, and we're not only celebrating the launch of this site here today, we're also having a celebration for the wonderful partnership that we have with the Villages Health. So we started working with the Villages Health back in January of 2023, and since that time we knew right away that our patient-focused values were aligned. We've seen over 700 TVH patients since we initially started working with them in January 2023, and the Villages Health team has been amazing to work with, and we cannot sing their praises enough. I'd like to introduce Dr. Riley, Medical Director with TVH, and we're so happy to have him here today.
Thank you,
Thank you, Dr. Riley.
No, thank you. You guys deserve all the applause. So, I think rain is good luck on a wedding day, so I think it must also be good luck when you're starting, a brand new office. So, but I want to thank Matt and Cheyenne and Megan for bringing me on today to say a few words. We began, so the launch of the center was last January, but the partnership was well before that in conversations, with Sage. At the Villages Health, we serve a huge faction of the Villages community. We have nearly 30,000 Medicare Advantage lives that we take care of, and an additional many more thousand commercial lives. So we're a very busy, growing, thriving practice, but one thing I've recognized, and I'm a physician, I'm an internist, I take care of patients, but also help work with our executive team and kind of all the functionality of our programs, make sure that our patients are getting the right care at the right place at the right time. And in doing so, as the medical director for all of our risk operations, it's become really clear that you can't get there without great partners. You can build a great model, you can build a great system, you can staff it well, but without partnerships with the right people, you're never going to get the patient exactly what they need. So we recognized early on that Sage had this tremendous mission statement, their core values aligned with ours to deliver exceptional experience to the patient. Right place, right care, right time. In our model, we have primary care, we have specialty care. So a lot of our patients do end up with requiring infusion services for their complex chronic conditions. Having been in the community, I've been with the Villages Health about 11 years, so I've been here to see kind of a lot of growth, a lot of expansion. And one of the things we always kind of tried to figure out was what's a good model for delivering infusion services to our patients. And by and large, it really wasn't much. I mean, patients are going to a place, feels very much like a hospital. Unfortunately, with sick oncologic patients right next to them receiving their infusions for chemotherapy, they walk in a building that says cancer care. It's really a tough thing for patients that are just going to get their 6-week cadence maintenance medication for their rheumatoid arthritis or whatever it might be. So we recognized that there was this opportunity to work with Sage. They've been a wonderful partner on the clinical side. The integration between what they do, what we do, took some ironing out, some of the kinks with the EMR and all the good stuff that comes with that. But I think we've developed this really terrific partnership, integration. And as a physician, I see patients who have been in and out of Sage over the last year and a half. Nothing but tremendous patient experience. I'm assuming you guys Net Promoter Scores off the charts, and wouldn't be shocking to know that it's high 90s, because you guys kill it. The patients are getting a much more comfortable experience. They get their infusion. I mean, look at this place. Feels like, it's nicer than my living room. So, who wouldn't want to come here to get care? You're just coming here to have a cup of coffee, right? So it's just it really takes that kind of that anxiety off their plate, off their mind. On the clinician side, we receive timely documentation. It's integrated seamlessly into the MR. I know when the patient's been here. I know which side the IV was placed, whether they had a reaction or not, how long the infusion took, and when the next one's going to be. We can track all of it. Just leads to more seamless patient care and a better outcome. So I'm really excited for you guys to have location number 2, and likely not the last one we'll see in the Villages. And as we grow and they grow and the continued partnership evolves and blossoms, I'm glad to be a part of it, and really great to work with this Sage team. So thanks for having me today, and good luck.
Thank you. And we also have some folks here from Amgen. I see bone health and rare disease. So it's always nice to bring the two sides together at a Sage event. We've done this previously. But we've been working with Noel Ruiz, the National Site of Care Director, for several years now. We were the first site to administer Tepezza for the treatment of thyroid eye disease to the first patient in Florida back in March of 2020. And since that time, we've really developed great relationships with the PALs, the patient access liaisons, and with the Amgen team. Our intake team meets with the Amgen team regularly, and we just have great coordination with them. And it's so fun to see the advocacy between both teams to get patients treated. So, Noel, we'd love for you to say a couple words. Thank you.
Thank you, Megan. Actually, tomorrow is May 15th, right? So I started with Amgen 4 years ago. So our relationship started day one. I got introduced to Cheyenne, to Matt, and we've been working together ever since. We were Horizon Legacy. We became Amgen a few months, 6 months ago or something like that. So it's been a great journey. It's been a great privilege. So I'm honored to be here today to speak to you guys and just say thank you, right? Our teams, as Megan said, have been working together, seamless. This is an important day, second location. I wrote a few things down. I didn't want to forget. I wanted to make sure I capture some things down. So I think that this is not just a physical expansion for Sage. I think this symbolizes their unwavering commitment to going above and beyond for patients. The second thing is that they strive every day to create a warm and welcoming environment for patients. The patients feel valued. Our teams tell us that all the time, how valued they feel, how respected they feel. Their mission is heartfelt. I quickly, when I was working with Matt and Cheyenne, I got the sense that for them, their mission is front and center of the patient. They're anchored in providing quality care, working with strong partnerships like pharma with our company and other pharmaceutical companies, and they do that seamlessly. The other thing I wanted to say is that you get a sense when you interact with them that they understand that they have a responsibility that's greater than the healthcare community it goes beyond the healthcare community that they serve. They're making a significant impact in the infusion space because they are anchored in that space that very few people, they say it, but they walk it, providing high quality care at a low cost with their full transparency. So I want to congratulate the entire team, everyone here, on behalf of all the rare disease folks and my colleagues that are here, Laura, Rob, Keith, and Nick in the back, and Cindy here. So we're so happy. Thank you for allowing us to be here, and congratulations on this expansion.
Thank you. And now I would like to introduce Rodney Nieves. Rodney is our very, very talented designer. He's also been working with Sage since 2019 for our Tampa location, and I'm not sure how him and his team do it, but each site seems to get better and better. So thank you, Rodney.
Absolutely. Thank you. I'm so very fortunate to be part of Sage Infusion. I met Matt and Cheyenne back in 2019, and I was one of, I don't know how many designers you were interviewing at the time, starting out in their Tampa location. But I tell you what, when I heard what their mission was and their value for Sage Infusion, I just knew that I had to be part of it. The fact that we can reinvent what healthcare looks like in terms of just from a visual perspective, and that was my job. Visually, how do I make you feel welcome, calm, and feel serene in an environment where it's more of a healthcare setting? So we are so fortunate to be part of them and part of their team. We are Structure Interior Design Studio, and what we do is we like to evolve each design with the approach on well-being and health-focused well-being. Just to talk a little bit about this particular location, there's always an inspiration for each location, but this particular location, the inspiration is called Seaside Forest. And Seaside Forest is basically walking down a forest that's on the coast of the sea. So the color palette is very reminiscent to that of a forest. Notice that the feature wall is an actual vinyl commercial grade wallpaper, abstract seaside mural. And the mirrors actually reflect, and I'm sure a lot of you can relate to this. Have you ever been in a park or a forest and you saw that sunlight just beaming through the leaves as you're sitting down? Well, that's what these mirrors represent. When there's actually sun outside, the light does reflect off these mirrors and create that little bit of a glow that you're inside an actual park. And then of course the cool tones represent the waves crashing on the seaside, and ultimately what that does from a color theory perspective and an art perspective is every approach to the color palette, to the texture, to the textiles evoke a sense of well-being. So we are so fortunate. Thank you very much, Matt and Cheyenne, for letting us be a part. And they let us take our imagination and run wild with it. They basically put no restrictions on us. They let us do what we do, taking into account, of course, their core values, along with the feedback from their wonderful team on how the place can function as well. So I'm glad to be a part of it. Thank you.
Thank you, Rodney.
Awesome. Well, now the ribbon cutting, I guess we can proceed with that.
Okay.